Actually like to start, sort of personally and just say I've been working with and around USAID projects for 15 of the past 20 years. For 2 years, right before the first Trump administration, I was a senior climate change advisor for Asia. What I'm really concerned about is the impacts on the ground. So, for example, in Thailand, where I'm based, there are 80,000 refugees who are now going without aid from Myanmar along the border. In Africa, the delivery of HIV, AIDS vaccines, malaria, and tuberculosis medicines has been stopped, even though they've been purchased. And in Afghanistan, the cessation of humanitarian aid is putting millions at risk of famine. So that's the on the ground, those are the impacts being felt.
How did you find out about the freeze, and what do you make of the way it's all being carried out? Are the consequences being felt immediately?
Well, a friend of mine said it's like, well, it started out with, so first of all, there are 7,000 USAID projects in 100 countries, and there are 10,000 USAID employees. And so the initial gambit that was put forth by the administration was to pause aid for 90 days on all 7,000 projects. And initially, a friend of mine said, that's like, you have a hospital and you say, well, the patients are there and we're going to cut off the electricity and the water and we'll be back in 90 days. And they actually want the patients to die. Well, here we are a week and a half later and the patients were just killed. Today, the administration has been canceling contracts illegally across probably most of those 7,000 projects globally. These are projects that were where the funding was appropriated by the US Congress. They cannot legally be terminated by the executive branch. And it's a travesty and it's a shame. And furthermore, the US is burning social capital, leaving a huge geopolitical vacuum, which is going to be filled by the Chinese. The development assistance and the diplomacy that the US and other countries provide is really the way to avoid wars and foreign entanglements. And it's just illegal and it's a travesty.
So many flow-on effects. The White House is promising a more strategic review of US aid, as I understand it. Are you confident this will be carried out effectively?
Well, okay, back to the analogy about the hospital. The patients were just killed today. The patients are the 7,000 USAID projects which are delivering assistance. They've been terminated, okay? So now Humpty Dumpty has fallen off the wall and is in a million pieces. So the only way to put that back together will be to rehire those people, go through tendering process to bring all that back. So I'm all in favor of a top to bottom review to root out waste and corruption. But we're talking about U.S. foreign assistance, USAID specifically, which is less than 1% of the budget. So it's really an ideological journey that they're on. They're not. If the administration was looking to save money in the budget, they would target bigger fish like the Defense Department or Medicare or Medicaid. So it's just an easy target. And I think the role of Congress, who appropriates the funding, should be to do a top to bottom review. And I'm sure you'd find ways of cutting assistance, but this has not been a review. It has been a sham. The 90-day pause was a smokescreen. And you've seen less than 10 days after the 90-day review was announced, they sort of presumably have reviewed all 7,000 projects and are canceling them. And furthermore, they illegally occupied the USAID headquarters in Washington and symbolically, I guess to sort of make a statement, they removed the USAID logo. It's terrible for foreign policy of the US, it's terrible for international relations, and it's just an abdication of US leadership.
Well, you've said your company can weather the disruption. Others won't be so lucky. Who do you think will be impacted the most across Southeast Asia?
Well, I've had the privilege of knowing and working with hundreds of US foreign assistance professionals and consultants who put themselves in harm's way, are in difficult environments, and they're stranded now. They've got unclear guidance. They've been terminated. You have families that have been moved. Sometimes they're in some cases they're in dangerous environments. In other cases, they're just stranded overseas without guidance on how to what the next steps would be. So it is completely a chaotic approach to trying to wind things down. It has been done. 65 years of building up U.S. foreign assistance has been demolished in 3 weeks, and it just makes it's soul crushing. That's the only word I can say. It's soul crushing to me.
So what will these companies and organisations do? Who can they turn to? What countries can they depend on? Okay,
we'll talk about the beneficiaries first. So as I mentioned, the HIV/AIDS vaccines won't be delivered. The hundreds, the millions of people in Afghanistan who no longer get humanitarian assistance from the U.S. Some of the other donors in Afghanistan may pick up the slack. And so donors are talking about how to do that. But the fact remains the U.S. is the biggest international provider of foreign assistance by far. And so, that's the reality on the ground. And it's, the legal actions and perhaps public protests, although I doubt that, foreign assistance is not a big item on the political radar of most Americans, but legal action to stop this will take weeks or months. And in the meantime, people will be dying. And, for Americans who might be in Australia listening to this, maybe you should call your congressman because, U.S. farmers have $340 million of food that would be delivered through food assistance programs. So they're suffering as well.
Peter du Pont, really good to talk tonight. Thanks so much for your time.
Thank you, Yvonne.